The risk assessment program is a joint project between Forest General, the Spirit of Women Division of Forest General, and Hattiesburg Clinic Cardiology. And technology has come to the point that we can actually tell people if they're starting to make plaque many times before they would get to the point of having a heart attack. We have made this information available to the general public, and it is not something that is covered by insurance, but it's very cost effective and affordable, and patients can call and make their own appointment for the clinic. And we have set out with the goal of not tying up more than 90 minutes of patient time to come in, get fasting blood work for cholesterol, lipid profile, blood sugar, get an EKG, get their blood pressure checked, and get what we are using as the mainstay of this, the cardiac calcium score. The cardiac calcium score does not require any tubes or needles. It does require a very high-speed 64-slice CT machine that is available at the clinic, and takes about 5 minutes total time to get that done. When we get through with that, the risk assessment clinic allows about 30 minutes of time with a nurse practitioner or physician's assistant to walk through an interactive computer program to show patients how they can figure their risk of having a cardiovascular event. And certainly those are based on average statistics. It's not that we can predict in any one person that risk, but it's still very valuable and very interesting information. When the patient leaves, the goal is that they can follow their cholesterol and plug those numbers into the computer program, because they'll have access to it 6 months or a year down the road, and see what impact they have made on their potential risk of an event. Ideal candidates to me are in middle life. Women by age 45 and above. We have younger ones come in that have strong family histories. So certainly it's appropriate for younger women if they have a risk of having heart disease, and men by age 40 and above. And I think what's really interesting is that, being in a coastal state such as we are in Mississippi, we all pay great attention to hurricane warnings. And most of us would do anything we could to get ourselves and our family out of harm's way with that. This is a piece of information that is very much like that. We could know in advance that we are starting to make plaque. We would have the opportunity, based on statistical studies, to actually modify our risk of eventually having a heart attack and prevent or slow that down. And there's nothing better than preventing a heart attack. Our group works very hard with Forest General to rescue and open arteries when someone comes in with an acute heart attack, or acute myocardial infarction is the big name for it. But there's nothing better than actually just preventing it. The whole test package is $125, and obviously the patient is paying for what they are getting, but the clinic and Hattiesburg Clinic Cardiology, with doing the calcium scoring, and the hospital have all worked to keep that number where it is affordable. We try to do these in the morning because the patient comes in fasting, so the cholesterol panel is more accurate and the blood sugar would be accurate. So we do them 5 days a week in the morning, and each patient is allowed a 90-minute window. Of course, sometimes we do go over if the lab's slow or there's some problem, but we really try to stay on schedule because people have busy lives and they're giving a commitment to come in and do that. But there is no after effect from having this done. Calcium scoring can be followed over time and is a very good test if it's 0 or low on the initial check. And the recommendation by many groups is to wait 4 or 5 years, and the 5 year is a very reasonable time frame if it's 0 to come back and have another calcium score, and still has great value. There is a little fluctuation. If you had 3 calcium scores in a day or in a week, then there would be a little fluctuation in the number, but not a great deal. So they're valuable in that regard. They also are very valuable, and what we alluded to earlier was if your calcium score is positive, then you want to know, how do I follow this? Yes, I'm starting to make plaque, but how would I stay on top of this? Do I need a stress test? Do I need a full cardiac CTA? Do I need a catheterization? And that information, again, goes back to preventing potentially a heart attack. So we want that information. We want to be able to help those patients plan, strategize, stay on top of this process, and slow down the process by altering the risk factors. It's particularly good for women who may not have the usual presentation with typical chest pain in the substernal area and going down their left arm or into both arms. Their symptoms, we know from studies, are a little more unusual or different than guy symptoms. And so if they're having unusual symptoms, this test could help them respect those symptoms. If they come in and know they have a 0 calcium score, then they're more assured that over the last several years they have not been laying down plaque in their arteries. On the other hand, if it's positive, then they certainly need to go on and have appropriate follow-up tests to assess how far along they are in that process. I think that for men, 40 and above is the ideal age group, and 45 and above for women. Again, if you have strong family histories, and many of our patients who do this have that and know they're at risk, so they're delighted to find finally a mechanism to find out where they stand. So they're coming in maybe 5 or even 10 years younger than that to be screened. But the general population without a strong family history of heart disease, those are good numbers. What's interesting in the older group, and we don't push it for older people, but as cardiologists we find it's still a very useful tool. The calcium score itself is a raw indicator of how much plaque we've been laying down. So even though it doesn't help me visualize the arteries themselves and say this artery's got a 90% blockage or an 80% blockage, the raw number or the amount of calcium in the total vessel does give me an idea of how far along the process is and what better choose those tests for the older patients as well. Peace of mind's invaluable. It is. And if you have a strong family history, we used to see people come in and they constantly were wondering what they should be doing, and they'd have a treadmill every year or two, and then they'd maybe come back in 5 years or 3 years, and that was just a guess, because if their treadmill was normal, it didn't mean they were not making plaque. The treadmill was trying to assess, was there evidence of an artery causing trouble at that particular moment. Knowing whether you're making plaque, knowing whether you've already started in this process of developing coronary artery disease is much more valuable information, because studies do show that if you get in there and address your cholesterol and you lower it to certain guidelines, you can reduce your risk of having a heart attack.